It's a pleasure to introduce Jen Hyatt. In 2007, she became the founder and CEO of Big White Wall. Big White Wall appreciates something about the power of a community and the power of technology to bring that community together. Big White Wall, particularly in mental health, recognizes something that we all know, everyone in this room knows is true. No family goes untouched. Even if the number of psychiatrists were doubled in the graduating class, which is only about 4% now, we still would never be able to reach those people who even want to go to seek mental health. It's in the power of the community, in the availability, the widespread availability of the technology that has been the source of Jen's ingenuity, her intelligence, which is far greater than artificial, her enthusiasm, and she's going to tell us now about how she has marshaled all those forces towards connecting us all with each other among peers in a community for good health. Jen Hyatt.
Thanks, John, and a big thank you to Joe, who's been a trustee and great source of support to Big White Wall ever since I met him 2 years ago. He's also one of my favorite writers on health, and it's a pleasure to be here. The thin line. '18, college, anxiety, partner, child, depression, hero, bomb, trauma, family, divorce, broken, life, death, loss. These people are you and I. They're all of us. And each of us believes that we're standing on solid ground. But actually, we are balanced on a thin line. A thin line between feeling mentally and emotionally well and mentally and emotionally unwell. And this is a crazy statistic that people throw out, that 1 in 4 people experience poor mental health during their lifetime. Who would dare say that 1 in 4 people experience poor physical health in their lifetime? It's nonsensical. Just like you can have everything from a common cold through to a terminal illness. You can have everything from low-level stress through to a severe and enduring mental illness. And the tragedy with mental health is that 50% of people who are experiencing poor mental health do not even get as far as their primary care doc. Mainly that's due to stigma. 75%, 3 out of every 4 people, get no treatment whatsoever. That is a huge human cost, but it's also a huge financial cost. $192 billion a year lost to US employers in lost earnings. In 2006, there was one number too many for me. My friend Alice lived in a shared student home with a guy called Bill, who was studying in the UK and was an American citizen. After university, in one of those, that wonderful shared experience, they all kind of went their own ways, and Bill joined the Marines. They kind of kept in touch, Alice and Bill, and then 15 years later, just after he'd left the Marines, Alice went out to the West Coast to meet up with him. And it was like the original love story. They realized that for really all of those years, there had been something very profound between them. And they moved back to London with a firm intention of marriage and children and a happy future together. But potentially because of the experiences that he had had in combat zones, Bill fell into a very deep depression. And it took 2 months for Alice to persuade him to go to his primary care doc. And his primary care doc recommended an appointment with a therapist a month later. That's the National Health Service for you. A month later. And that month was still not good. Bill was still very, very low. And come the day, though, of the appointment, Alice was pleased to see that, he got out of bed, he dressed, he shaved, things he didn't do most days. And she went off to work with some optimism. And Bill went off for his therapy appointment. And when he got there was a note on the door. And it said, "Therapist sick, all appointments cancelled." And Bill went home, and he wrote his own note. "Call an ambulance, do not come in." And it was too late for Bill. Now, it may not be that every one of us has experienced a tragedy of that nature, but for each of us, there's always been one too many in terms of somebody experiencing poor mental health. And it's for that reason that I founded Big White Wall, to enable people without stigma to be able to easily access support digitally. I just want to show you a very brief film about what it does.
Sometimes we all get down, knocked down, scared, isolated, anxious or sad, hurt or angry. Big White Wall is here to help you work through whatever's troubling you. Here you are anonymous. There is no stigma. Here you'll find a wealth of support from a community of people who feel the same as you. Joining is easy. Simply check one of the boxes on our landing pages. You can begin to find support and help. The first thing you will see is your own personalized homepage. This will help you find all you need in one place. There are many things you can do on Big White Wall, which you can access from your computer or via your mobile or tablet. Engage in a community of support. Express what you are really feeling in bricks and talkabouts. With trained wall guides on hand 24/7 to make sure you are okay. You can access lots of useful stuff and take clinical tests to help you understand what is going on. These will also help you track your progress over time. There's also a wide range of guided support programs. Here you can join professionally led groups to help you deal with issues from depression and anxiety to getting a better night's sleep. And then there's live support, where you can speak to your choice of clinician from home at a time that suits you.
Hello and welcome to Life Therapy. How can I help you?
95% of our members feel better as a result of using Big White Wall. 73% share an issue for the first time. And 80% of members self-manage their issues through Big White Wall. So however down you might feel, you are not alone anymore. Get support. Take control. Feel better. Big White Wall.
So technology that helps us manage the thin line. And I want to just talk using Big White Wall as an example, but there are many others in physical healthcare as well as mental health care, about how technology can provide 3 types of safety net. The first is through social online communities. Big White Wall in 2007 was founded around a community in which people were anonymous and could provide support. And they provide support by remembering important dates in people's lives, births, deaths, anniversaries. They remember the details of maybe when somebody's going back to work for the first day after being homesick for a couple of months with depression. They remember by offering celebration when somebody's PHQ-9 for depression actually improves, and they can reach out and support people when the scores go up. One of my favorite groups, if favorite's the right word, on Big White Wall has been going now for 3 years. And it was formed by a group of survivors of childhood sexual abuse. And they call it the Little Ones Crash, because in it, they heal the little ones that were damaged inside of them. And it is quite incredible what has happened within that group space. So online social communities, if they are well curated, provide incredible safety nets for people. And they do it more than just reaching out and supporting one another. They also do it through co-creation of the service itself. So Big White Wall has developed and grown through the community and what they wanted. And it was the community that said they wanted greater professional involvement in 2000 and late 2007 that led to the creation of what I call the second digital safety net, which is clinical. We developed a system that enabled the community to be held by people who are in the States, are Masters Qualified Social Workers. But their role is not to act as clinicians in that space. Their role is to ensure people are safe and ensure that they engage. But technology enables us to do this at an unimaginable scale. As John said, you could never scale up what exists offline to meet the level of need. And more, you could never meet the nature of need because of those 50% who will never come forward because of fear of stigma. So here's a statistic. In 2007, we could manage with one person, one of our Masters Qualified Social Workers, full-time, 24/7, could manage 350 simultaneous logons. Today, as we've automated the technology, that figure is now 1,500 to one person. And it shows you that if the social safety net doesn't work, there is a clinical safety net underneath it to ensure that people will be able to be supported through that. But both, of course, are driven by something more. Both are driven by what I consider the most powerful safety net of all, and that is data. We have accumulated an incredible amount of data over the last 8.5 years. And we've utilized that now to correlate people's content, their stories, their contributions to other people's situations, their engagement in courses. We've correlated their content, their natural language, with their scores, for example, on a PHQ-9 for depression and a GAD-7 for anxiety. And now if somebody contributes just 20 words of their story, we can predict with 90% accuracy their score on a PHQ-9 or their score on a GAD-7 for anxiety. And this enables us to do two things. It enables us to personalize what we offer to that person, so they are offered up other people, tools, resources, content that are appropriate to their situation and their level and their needs. And secondly, it enables us to risk stratify so that we can ensure that those with higher levels of acuity follow the right clinical protocols and move either through our service or into an offline healthcare service to get the appropriate level of support and treatment. So data for me is the big hope of the future. And I see now that where this is taking us, there's so many exciting developments, many of them here in the US. In Maryland, there's fabulous work going on now about voice recognition for depression. There are companies like Credo that are doing facial recognition for anxiety. And I think if you put together, the natural language work that us and others have been working on with facial recognition, with voice recognition, you have an incredibly powerful set of tools to ensure that nobody falls off that thin line and to ensure they are caught. Now, a lot of people are, the robots are coming, and I can't wait for the robots to come. I'm a huge fan of AI, and I look at things like Ellie, who is the AI psychologist created by the Institute of Creative Technology in California, and look at Ellie's results, which is she gets double the rate of disclosure and higher satisfaction ratings than the human psychologist. We have to remember when we're thinking about AI, what is most important here? The outcome for the person concerned or the person who delivers it? For me, it would always be the person with the mental health issue or other issue. But there are, I think, also ways that we can combine AI. There are ways we can combine robotics and use data, not in a scary way, but actually to be able to offer new ways of providing those safety nets to ensure that, I just realized I stepped off the red thing. I hope I haven't fallen over my thin line. I'm supposed to stay on the red thing. I think there are some fabulous examples, and I just want to share with you a very short clip from one of my favorite movies about the future that I'd like to bring on.
Hello, I am Baymax, your personal healthcare companion.
Hey, Baymax, I didn't know you were still active.
I heard a sound of distress. What seems to be the trouble?
Oh, I just stubbed my toe a little. I'm fine.
On a scale of 1 to 10, how would you rate your pain?
A 0? I'm okay, really. Thanks. You can shrink now.
Does it hurt when I touch it?
No, it's okay. No touching. Ow.
You have fallen.
You think? Ow.
On a scale of 1
Ow.
on a scale on a scale
No.
on a scale of 1 to 10 on a scale of 1 to 10, how would you rate your pain?
0.
It is all right to cry.
No.
Crying is a natural response to pain.
I'm not crying.
I will scan you for injuries.
Don't scan me.
Scan complete.
Unbelievable.
You have sustained no injuries. However, your hormone and neurotransmitter levels indicate that you are experiencing mood swings, common in adolescence. Diagnosis? Puberty.
Whoa, what?
Don't you just want to take Baymax home? I'm sure do. So let us not be afraid of technology. Let's walk bravely into technology that can provide safety nets to help us manage that thin line and live mentally much healthier lives. Thank you for listening.